Welcome to Uncaged. Today we're speaking with Chere Gregory. Hey, Chere is at one of my favorite companies, Novant Health. We'll go through a little bit exactly about Novant Health in a second. She's the Chief Health Equity Officer there. Novant Health is a four-state integrated network of physician clinics, outpatient centers, and hospitals. Its network consists of more than 1,600 physicians and 29,000 employees at more than 640 locations, including 15 medical centers and hundreds of outpatient facilities and physician clinics. Chere, that's a mouthful. That's a lot. There's a lot going on at Novant these days. But before we get into the Novant story, let's talk a little bit more about you. Tell me a little bit about you and your career.
Thanks, Ben. It's great to be here. So, as you said, I'm the Chief Health Equity Officer. I'm a practicing physician. I'm board certified in vascular neurology and neurology. So, as a physician, I have the opportunity to impact the clinical outcomes for our patients. And then, as an executive physician, I have the opportunity to really think more strategically about how patients are impacted across the system, even those that I don't personally take care of. And as you described, we have an incredibly large footprint. So at Novant Health, health equity really is the responsibility for all of us in order to be able to deliver on that promise. And one of the things that's really important to us is that we connect with the organizational priorities that make the most sense for our communities and patients. So we want team members to be able to provide culturally and linguistically appropriate care. We want to be able to provide the best practices for addressing things like social determinants of health that really impact the outcomes of patients very differently than just the actual care that we provide. We want to be able to have best practice in looking at and addressing health inequities in outcomes and clinical variation. So our team really does look at what happens to patients and community members within the walls of our medical venues of care. But then maybe even more importantly, our team knows that not everyone can come to us and have access to us. And so I lead the team that actually meets people where they are, that goes into the community and provides community health services and community benefit for those folks who are ordinarily historically underserved. And I think that's the best combination of the two to make sure that there's health equity in clinical care venues, but also to be sure that we're providing health equity outside of our walls, where much of what happens to people unfolds. 80% of what happens in clinical outcomes for people has to do with their social determinants of health. That's where they work, play, pray, shelter, grow all together.
So, I mean, that's great. And clearly, Novant Health plays a big role in the broader Carolinas communities. Tell me a little bit of some of the unique challenges that you face with that health equity story in the Carolinas.
So one of the challenges that we have is food insecurity. Over 14% of the North Carolina population is food insecure. And I remember when I first entered into the health equity space, that was introduced to me as not having enough supermarkets nearby, but it's much deeper than that. When you actually start having conversations with patients, you realize that there are families and patients that don't have food for the day. So food
Right.
insecurity is a food emergency. That's one of the reasons why we initiated the Novant Nourishes program, because when we did over 1 million screenings, we realized that there was a disproportionate number of people who were food insecure in the region that we provided care. And we had to be able to leverage our resources across the system to provide emergency food packs at clinics and when they were needed, and to have community partnerships to connect people to food resources so that it wasn't just food for the day, but actually real resources that help them. We can write prescriptions for taking care of diabetes and high blood pressure, but if there isn't food, good, healthy food for patients, then we're only addressing part of the problem. And so that's really been one of our focuses. I think the other one is a national problem, not just in North Carolina, around maternal and infant outcomes. We are in a situation where in our country, we don't have the best maternal and infant outcomes. And in particular, Black women and women of color are more likely to have bad outcomes during their pregnancy. So
Hmm.
we have worked very hard to create a long-term goal that looks at how do we address that problem that's really plaguing the entire country and our region. And it's something that we're really proud of the work that we've been doing over the last couple of years.
Yeah, I mean, those two areas are incredible. And it's really, I think, it tells a lot about how you and the Novant team are taking a very holistic perspective on thinking about the health solution. Clearly, it's not just about a procedure, a medical procedure, it's about thinking about the causation between healthy food as well as the whole kind of medical process. And, that maternity challenge, I've seen that for years. I think I was exposed to that working on a UN committee for women, and it's quite galling that the US actually has such a problem in that space for such a kind of a modern nation. But certainly, I think taking these positive steps forward are spectacular. So, I mean, tell me a little bit. I know that one of the things that Novant faces, other than kind of other groups, is that you have not only kind of the urban centers that you have in a place like, Winston-Salem or others, but certainly there's a lot of rural communities that you guys work with. How do you balance kind of that urban rural challenge?
That's a great question, Ben. That's part of what is important to us with community health services. So, being able to leverage mobile units to be able to go out to areas that are less served. We often look at our entire footprint for the patients that we care for and understand where there may be unique needs or pockets of care. So, for instance, if there isn't an endocrinologist, how do we place specialty services and leverage
Right.
telemedicine in order to be sure that people in rural areas get the services that they need. And then we're faced with technology equity, where they may
Hmm.
not even have access to the systems that they need to have telemedicine. So it really is a combination of and a careful balance of outreach and mobile units, telemedicine, making sure that we locate geographically our clinics in areas where patients and communities need those services most, making sure that we can move our diagnostics like mobile mammography to areas where ordinarily people would have to drive an hour or more to be able to
Mm.
get those diagnostic and screening services. So it really is a combination of all of the things that our communities tell us. When we do community health needs assessments, it really sort of helps us to understand what bubbles up to the top for communities and what their concerns are. And then we, in partnership with communities, with voices of the community, really co-create the types of services that are needed and the education that's needed in different regions across our footprint in order to address those community health needs assessments.
So you mentioned a lot of the technology that Novant is bringing to deliver these solutions like telemedicine, et cetera. Are you seeing a lot of promise in those areas?
I do. I think that there are still limits. Those communities that are historically underserved don't always have access to
Mm,
technology. We are learning how to use phones that are less smart, for lack of a better description, where it's just texting and easy ways to access information with your phone. Often people have phones, even if they don't have the high level of technology like having computers. So,
mhm.
to be one of the first in the region to launch Epic text messaging services has been really important to us because we want to be sure that we're able to connect and communicate with people with the technology that they have available.
Yeah. Well, let me change gears a little bit here, Cherie, because I mean, clearly you've had an incredible medical career and now playing a key leadership role at Novant Health. But I always kind of try to get an understanding of why do we all do what we do? What drives that passion? And tell me a little bit about what got you into the medical profession and what kind of drives you every day to keep going.
I think my career started when I was growing up. I was told that ever since anyone could remember, I wanted to be a physician. I was very fortunate to have an African American male physician who actually asked my mother, who was a single mom at the time, what were our social determinants of health needs. And he
Mm,
realized that she needed to have a second job and offered her a job in the office. So
wow.
I actually got to grow up hearing about healthcare, and my mother and my grandmother really pushed for me to have academic excellence. My grandmother was a housekeeper and ultimately decided to go to school to be a nurse. So I got to see women in my life really strive for, essentially against all odds, and be
Yeah.
kind of blazing pioneers. So it really gave me the opportunity, I think, to understand that anything was possible. And I think what really brought it home for me in the health equity space, when I was in medical school in my freshman year, I actually had quite a few of my family members die during that first year of medical school. And
Mm.
I don't know that I knew it was health equity at the time or disparities at the time, but my family was experiencing disproportionately to other classmates that I had cardiovascular disease, because they
Mm.
were from rural areas of North Carolina and didn't have good access to care. And so I remember thinking that this year was much harder for me than a lot of others. I even had a conversation with the dean of students, who wondered if maybe I was just under stress and
Yeah.
making up these stories of how many people I was losing in my family, because it was so different from many of the other students in my class. And so
Yeah.
I realized that there was something different going on. And so as I finished my career, I was really looking at and paying attention to the fact that there were groups of people that were disproportionately impacted. And that's what became really important to me. I am a product of someone asking about social determinants of health and community health services, and now I
Yeah.
lead that, and it's really my why.
Yeah, well, I mean, that's an amazing story. And it is kind of leading to that thought where these determinants have such a huge impact on the quality of opportunities. We've seen that in almost every area of our lives, technology. And I think a famous story is about how Bill Gates just happened to live right next to one of the most advanced kind of computer systems in the country when he was a child and happened to be able to code and utilize it. And, little things like that make a huge difference on the path that your life takes. And healthcare is a huge challenge for us, and making sure that it's equitable is absolutely key. So tell me a little bit, when you think forward here and look at next year, Cherie, what do you see on the horizon for 2024?
Well, I when I think about what's on the horizon, one of the things that comes to mind is the most recent US Census. So we are becoming a much more diverse country. And as a result, probably more than ever, healthcare systems have to not only provide high quality of care, which I think most people assume they will get when they come into the healthcare system, but it really has to be patient centered and individualized. And that really requires us having an organizational readiness, and maybe even some cultural humility. We're not going to know everything about everyone, but we need to be empathetic, and we need to listen to our patients and be able to understand better what their individual needs are. It seems simple, but it's not
Mhm.
necessarily something that everyone is born with. I mean, you really do have to work towards being able to hear and listen to that community voice. It really is around data and looking at not just the successes of the overall patient population, but understanding better by dimensions of diversity, whether
Mhm.
someone who's being included in the successes clinically and who is being left behind, and really leveraging resources not just within the system, but outside of the system. Much of what impacts healthcare has absolutely nothing to do with the clinical care provided within medical venues. It requires us to be really innovative, we
Yeah.
have to have cross-sector partnerships and leverage people with subject matter expertise in shelter and transportation and creating gardens and food resources. That isn't necessarily a healthcare industry subject matter expertise. And so it cannot just be the work of one sector. So
Yeah.
in 2024 and beyond, we really need to be very innovative across sectors and partnerships in order to be able to address the needs and the disparities that we see
Yeah.
in our communities.
Yeah, I also think there may be another challenge too, which is just how do you break down these walls here? I was chatting with a woman who is leading nursing at one of the major hospitals in Brooklyn, and she was telling me how challenging it was to get African American communities to utilize things like the vaccine for COVID. And she said it was really challenging just to break down the walls on that one, where there was just such suspicion that it wasn't going to be viable. and trying to understand how we get to a point where we can educate and move forward, but at the same time, kind of like present it in a way that it can be helpful, right? It's a real challenge. But certainly, I would say that what I'm hearing today from what you and the team are working on at Novant, there's some huge steps moving forward. I'm really heartened to hear kind of the holistic approach that you take. It's so funny that people always use fancy words like holistic, but the reality is that the stuff you put in your body is going to have a big impact on the medical needs that you're going to have down the road. So the Novant nutrition thing sounded fascinating. If someone wanted to learn more about what you and the team are working on, Chere, where's the best place to find you?
You can come to our website at www.novanthealth.com. One of the things that you talked about, Bant, that I think is important is around community partnership and trust. So when we
Yeah,
were faced with the COVID pandemic, we weren't going out into the communities and building relationships for the first time. That is
yeah,
really critical on
yeah,
what you talked about. That mistrust is very much part of many communities. When we
yeah,
were talking about making sure that we had distribution of COVID vaccines, we went to our business resource groups that represent many different groups of people and said, share with us what's on the ground. What are you hearing
yeah,
out in the communities? We heard things about COVID cookouts where people were bringing family members together because they thought it was like chickenpox. And we wouldn't have known that if community members didn't trust us to share with us what they did understand and what they didn't understand and what they were afraid of, so that we could
right.
incorporate that into our community education and just listen and be reassuring and not judge some of their clear understanding of the history of our country, and then some
Yeah,
misunderstanding about where
yeah.
there are
I
opportunities.
think, you hit it on the head there, which is this idea of just this ongoing need to find ways to strengthen trust, build trust, and then just get out in the community and participate with the community. At the end of the day, that's really what this whole thing is about. So, anyway, thank you so much for being on the Uncaged show today. We've been speaking with Dr. Chere Gregory. We've been going through a lot of topics, but really around the heavy role of health equity, trying to make sure that Novant can bring quality solutions to all communities that it serves, whether it be diverse communities on race, but also urban and rural communities, demographic age groups. Everyone's got different challenges, and trying to make sure that we find a way to deliver those broader, integrated, holistic solutions is an easy job, right, Doc? But thank you so much for shedding light on everything that you and the team are working on, and we look forward to having you back.
Thank you. Appreciate it.
Cheers.